Hello and welcome to our presentation. We are doing mass spec in medicine. Mass spec was first invented by physicist J.J. Thomson accidentally, as he was actually searching for an instrument that could measure the mass of an electron in 1887. A few years later, in 1899, he used this research to build the first mass spectrometry instrument. Alfred Neer, a researching physicist at the University of Minnesota, worked on mass spec in the 1930s so that the instruments could be safer and useful for more people. Neer built several revolutionary instrumental designs for mass spec that helped move the field forward. However, in the 1940s, mass spec was still not used and trusted by many in the field because many people didn't know how the machines worked. Fred McClaffery, Klaus Biermann, and Carl Djerassi were scientists who were all able to use experiments to lead to the trust and usage of instruments in the physics and chemistry fields. By the 1970s, molecules were regularly measured and analyzed with mass spec instruments, but nucleic acids and complex carbohydrates were more difficult to analyze. Because of this, scientists need to come up with new mass spectrometry ionization techniques to help with analyzing compounds. In 1975, atmospheric pressure ionization was first invented at Baylor University. This technique was used for easily detecting nonpolar or slightly polar species. In 1988, John Fenn, an analytical chemistry professor from Yale, helped develop the electrospray ionization mass spec technique, which helped find the mass spec uses for amino acids, polymers, and proteins. In 1985, Franz Hillenkamp and Michael Karras, researching chemists from Germany, invented a new mass spec technique called the matrix-assisted laser desperation ionization, which was used to find the mass spec of biomolecules such as lipids, peptides, and nucleotides. The U.S. Strategic Defense Initiative, nicknamed the Star Wars program, was a proposed program in 1984 to defend the U.S. from incoming nuclear missiles. When the Star Wars program shut down, many of its components for the program, including many IR-free electron lasers, were made available for biomedical research. Some of these lasers were used in MALDI equipment, which made the mass spec technique soft enough for proteins to be analyzed, but it was more difficult and expensive to use compared to UV MALDI. Rainer Kramer, a bioanalytical professor from Reading University in the United Kingdom, helped develop protocols for analyzing proteins in bloods and other bodily fluids. Today, clinical mass spectrometry is used for diagnosis purposes in medical labs. Mass spec can diagnose metabolism deficiency, whether enzymes are present in the body or not, and toxicity testing.
As Matthew had said, some of the current applications of mass spec do include forensics, toxicology, and clinical diagnostics. Mass spectroscopy in toxicology and forensics, it can be used in toxicology report in distinguishing different ionizable chemical compounds. It can be used on dried blood samples and other bodily fluids and remains to test for drugs that have been abused, and also metabolites. Mass spectroscopy is currently the gold standard in drug testing, and also screen assays are used for narrowing down compounds in forensic analysis, whether it be drugs that have been used or abused, trace gases at a crime scene, residue that can determine the start of an arson crime and or the fuel that was used, gunshot residue on walls and on suspects, and to trace fibers, hairs, and other things found at crime scenes. Mass spectroscopy used in clinical diagnostics, it can be used to test small doses or amounts in pediatric patients that are traditionally unable to provide large samples and or the normal size samples. It's able to test and distinguish between different types of vitamin D and the amount of each, giving the ability to label a deficiency, which can lead to cancer and other cardiovascular risks. It can also test for metabolism deficiencies via finding the buildup of proteins or amino acids, such as phenylketonuria, which is a form of metabolism deficiency where one cannot break down phenylalanine, causing the buildup of phenylpyruvic acid, phenylalanine, and phenylacetate. Mass spectroscopy can also be used to show the presence of biomarkers and enzymes in patients.
Mass spec is vital to modern medicine, but it has the potential to be even more useful and save even more lives. And a major implication of this, like Xander said, is that it can be seen in the field of proteomics, which is the study of the proteins present in the body and what they're used for. And for example, if a certain protein is used to fight off a certain irregularity or disease in the body, that protein can then be linked to that regularity and labeled as a biomarker of it, or an indication that that certain irregularity is present in the body. And then once that biomarker has been identified, samples from the patients can be used to diagnose metabolism deficiencies and other diseases, such as many forms of cancer. And with these diseases, early diagnosis is vital, as they're easier to treat the earlier they've been detected and could significantly increase the survivability of these deadly diseases. And so mass spec has a very prominent future in early detection. And that's why there's such a large field in searching for these novel biomarkers through testing those current patients with different variations of mass spec and the different settings. And then specifically, the usefulness of mass spec can be seen in its contribution in identifying the biomarkers of ovarian cancer, as well as its potential for detecting its symptoms detecting the disease before it even arises. And ovarian cancer is a deadly disease with a survival rate of only 46.5%. And that can be attributed mainly to its difficult in early detection, because the symptoms can be vague. And unlike many other cancers, there's not really an accurate screening test to detect the danger before those vague symptoms arise. But however, through mass spec, we have identified the proteins CA125 and HE4 as important biomarkers for ovarian cancer. And the picture shows the difference in spectra of a normal ovarian tissue and a cancerous ovarian tissue. And differences like these are commonly analyzed to identify various biomarkers, and were used in this case to identify these two proteins as biomarkers. But however, in the case of ovarian cancer, the proteins, while effective in tracking the progression of the disease in someone who's already been diagnosed, they still fall short in being able to detect it early due to the inconsistency of the CA125 and HE4 protein levels in a woman's body throughout each month. There's a lot of fluctuation in that. And so there are two main approaches that are currently being used to increase our ability. The first is just to simply study these two proteins more, try and get more information to detect trends in the variation. And then the second is to search for more biomarkers for ovarian cancer, where some researchers have found some success in this. And the first hormone, norepinephrine, has been identified as a potential biomarker, which is good news. And although no specific biomarkers have been identified in searching in mitochondrial proteins, there's increased belief that through more testing, we will be able to find effective biomarkers in those.
Despite all the positives that are going on right now in the world of mass spec with medicine, there are still some limitations, as there are with other things. One of these limitations is that mass spec can be very expensive. So gas chromatography and liquid chromatography mass spec devices are extremely complex, as they're essentially two devices in one, which can cause them to be very costly. Another limitation is that mass spec in the field of medicine is still a relatively new field. Because of this, scientists are still learning how to execute and perform the most accurate tests on these patients. And because of this, agencies are very hesitant to support these MS-based methods without extensive research being done first. Also, these tests can be very time consuming. If you're using a very large molecule to test on, these tests can take hours on end to run. Also, because of the expensiveness of these devices, most of the times hospitals and other agencies do not have their own mass spec, and so they have to send their samples elsewhere, which can add to the more time being taken for the tests. Also, these mass spec devices are very bulky, which can lead to these devices being unable to be moved from different rooms. Despite these limitations, there's a lot of new technology coming out in the world today in mass spec with medicine. A lot of these devices are focusing on point of care with mass spec, which means they're working specifically directly hands-on with patients. Because they're working directly with hands-on with patients, they're able to be much more efficient and effective when they're testing and diagnosing these patients. Specifically, one of these technologies is called iKnife. The eye knife cauterizes tissue directly during surgery, and then directs these fumes into a gas chromatography mass spec device, which then is able to identify healthy or diseased tissue, which can help to diagnose patients further. However, one more limitation on this device is that it's still connected to a bulky gas chromatography device in the room. One interesting thing we found during our research is that Purdue is leading the front for a new technology in this industry, which is called a miniature mass spectrometer. Dr. Graham Cooks and Professor Zhang Ouyang are heading this research. Dr. Graham Cooks is a distinguished Purdue chemistry teacher from 1990 until the present time. He has tons of research on Purdue on mass spectrometry. Zhang Ouyang received his PhD from Purdue in 2002 and worked alongside the Weldon School of Chemical Engineering. Some of their first models began in 2011. Their first prototype was around 22 pounds, as opposed to some of the other bigger mass spectrometer devices, which are around 300 pounds. Their first model was the size of a shoebox and was able to run tests within a matter of minutes. Ouyang and Cooks were able to found their first startup company called PerSpec in 2015. They were able to partner with a university in China called Tsinghua University. They were also able to receive some state and federal funding, which allowed them to then license and put out 3 different products. At first, when they were starting this company, they were focusing on food production. However, they did see the upside for medical usage, including surgery and other use for the first responders. So we thought this was very interesting how Purdue is at the forefront of this industry. Thank you for listening, and I hope you learned a little about mass spectrometry in the world of medicine.